So unfortunately, racial and ethnic minority patients have experienced disparities in not only the care that they receive, but also in their health status. And that's not just the fault of their medical providers, but it's due to a lot of complex conditions that they live in, their economics, their education, their housing, their lack of transportation, and all those things become barriers to them getting to the doctor or to the hospital for effective medical care. What a medical home could do, first of all, is give everyone a regular provider, and that's really important to know where to go, when they can access that provider. That provider under a medical home will have something called expanded access, so that there'll always be somebody that answers the phone. That way people don't have to go to the emergency room, people don't have to go to the hospital if they don't need to. Simply establishing that sense of a home base, which is the idea behind a medical home, it's some place that you can always go to not only get care, but also get your questions answered. Once you have a medical home or a regular healthcare provider, whether it's a doctor or a healthcare team that the doctor has put together for you, then it's really important that that doctor sits down with you and says, what's going on in your life? But really establishing that relationship so the doctor gets to know you. And once that happens, then the doctor can say, well, let's work on some goals for you. Everybody should have what we're calling a care plan that says, I have this relationship with the doctor, and the doctor and I together are going to set these goals and work on this plan to get me healthier. The next piece is once you have a care plan, and again, whether you simply want to do a little bit better and get a little healthier or manage a chronic disease or a more serious disease, then it's really important that the patient also become a real partner and active in making sure that that care plan gets put into effect. Not just taking medication or going for their tests or going through the treatments, but also, for example, if it is losing weight or eating better, setting realistic goals and almost being a coach or a counselor and checking in and saying, how are you doing, getting the encouragement. So again, having all this in place in a medical home would really help a lot of folks, but would especially help racial and ethnic minorities.